So ensuring a healthy lives for all and well-being is one of the focus of the Sustainability Goal 3. Yet where we are today, more than 2 billion people do not have access to essential medicines. And the data shows that nearly 380 million people on an annual basis is pushed into poverty because of the burden of paying for access to healthcare services and medicines. So what we can see is actually a huge challenge, and there's a global gap on equitable access to medicines and vaccines. So to address this challenge, one needs collective action. And this means that we need to partner across the ecosystem with elements to focus on addressing these barriers across the patient journey, addressing the affordability challenge that we see, but also addressing the aspect of how can we make this sustainable and more equitable within the context of our partnering approach, and so that a broader spectrum of the population can benefit. Access to healthcare is very, very complex, and it is very much hyper-localized. Some of the examples that we've seen as challenges across the healthcare system to enable access is that of the inequity, as well as the under elements of resourcing that we see within capacity, health infrastructure, basically the ability for patients to get diagnosed, get tested, and get access to healthcare. Affordability always remains a challenge within the whole framework, as well as training, capability, and policies. And these are just some of these examples. So it is actually quite a complex framework, which we see, and all of these elements needs to come together and addressed in a collective framework with the partnering approach. We've heard quite a bit about how access and the access to medicines and vaccines and healthcare is complex, as well as it's very much hyper-localized. And that entails is that not one player can fix this problem. We therefore need to have a collective effort of expertise that comes together in addressing this at a local as well as on a global level. So essentially what we're looking for is partnering and collaboration across the ecosystem to mobilize and bring forward levels of expertise. So Takeda is committed to continue to broaden sustainable and equitable access to our medicines and vaccines. Our first priority is to continue to discover and develop life-transforming treatments that patients are in need of. And then how do we make these medicines available? Is making them available in countries, addressing the affordability barrier by our tier pricing approach and partnering to bridge these affordability challenges that we see, but also understanding that there's a broader partnering approach to address the barriers across the patient journey. The other element which we feel very proud of is that we don't take an approach which is separate from our business. To enable a broader access and a scalable and sustainable approach, it's an integrated business approach at Takeda. And therefore, we believe we can continue to make progress towards a more sustainable framework and equitable in the world and in the countries in which we operate, including that of India. So Takeda has been incorporated in India since 2011, and we've got several of our therapeutical areas available in India. But as also we've heard and from many distinguished guests and speakers in our event earlier today, is that the challenge of access is very complex and it's very much hyper-localized. So some of the elements that we've seen as an example in how we are addressing this challenge is firstly to make our products available. That as an example is our oncology products. Then we address the affordability challenge by how we price our product, and also is how do we bridge this affordability gap. And this is where Takeda has put in place an affordability-based assistance program whereby we partner with local partners, whereby patients are individually assessed how much they can afford and they pay what they can afford.